The COVID-19 pandemic continues to be a challenge globally, and Rwanda is not an exception. Be that as it may, residents have adapted to the ever-changing dynamics of the pandemic and commend the direction the country has taken to fight the spread of the virus.
Personally, I feel Rwanda has handled it well. We're among the first African countries in East Africa or even in Africa to get the vaccine. And so far, it has rolled out in very many places. Most of the people who work in public sectors have been able to get the first shot. And we hope by the time the second vaccine comes in, the second shot actually, comes in, and then the rest of the population will be able to get the first shot as well. So, and the other thing I think that has helped is the restrictions, the guidelines that people have been able to follow.
The Rwanda Biomedical Center describes the current status of the pandemic in the country as generally under control, with a 1% positivity rate as trends are slowly improving, with an exception of some districts in the country. However, efforts are underway to contain these infections. Speaking to Dr. Sabe Nsanzimana, the Director General of the Rwanda Biomedical Center, he says that even with the limited supply of vaccines, there are many ways being explored to acquire the vaccines.
Globally, the challenges of accessing to vaccines. For those who have to get the first one, those who are actually waiting to get the second one. So Rwanda is not an exception to that global challenges, especially with the India situation, where most of the exports have been put on a pause, and for even for Rwanda case, we had even purchased a number of vaccines that were waited to come. But nonetheless, there are still many ways that are being explored to get the vaccines. We wish that they could come as soon as possible. At the current stage, we are not really much worried about the delays in terms of what the vaccines does in the people's body, because for AstraZeneca vaccines, actually, the longer you wait, the better sometimes. So we don't know exactly how long, the longest you can wait. Those organizations increase the waiting time up to 8 weeks to 12 weeks. And now they're looking at what about slight extension.
About 8 doses per 1,000 people in sub-Saharan Africa have been administered, a clear indication that Africa still lags behind when it comes to the vaccination rollout. In an exclusive interview with RBA, Dr. John Nkengasong, the director of the Africa Center for Disease Control, he points out that urgent action must be taken in facilitating equitable distribution of the COVID-19 vaccines.
Where, as a continent, we have been left behind. And as a continent of 1.2 billion people, aspiring to vaccinate at least 60% of its population by the end of 2022, we cannot say that we are making progress with the current level of vaccination, which stands around 1.4% of the continent there. So we should act, again, as I indicated earlier, with a total understanding that this virus will not be defeated if only parts of the world are vaccinated fully and certain part of the world is struggling, like Africa and other regions of the low and medium income countries. So the point here is that it is not late now, because as I indicated earlier, we know where the vaccines are. Countries who have accumulated excess doses of the vaccines know that this is about collective security, health security, and if they do the right thing now, and we do it at scale, we should be able to catch up with the situation. But time is not on our side, because the virus is seeding itself in the remote communities. It will be very difficult to catch up there. If we do not do that, then the risk is that we may be moving slowly towards endemicity of the virus, which means the virus becomes another HIV, another TB-like in the community, which will be very devastating for all of us.
The COVID-19 vaccine rollout across some African countries has been described as exemplary, with Dr. Nkengasong commending Rwanda for being a model in the fight against the pandemic.
And I'm also very pleased with the uptake of vaccines in Rwanda, where I have been informed reliably that of the 290 doses of the AstraZeneca vaccines that were shipped to Rwanda. The country has used them all, and they used them in a very short time. That is exceptionally good. That is exactly what all African countries should be doing. Vaccines save lives. And the COVID vaccines are not different from other vaccines that we have used as during childhood, like the measles, the polio, the cholera vaccines there. So again, I doff my hat to the people of Rwanda for rallying behind public health and practicing good public health or demonstrating good public health practice.
Africa's goal is to vaccinate at least 60% of the 1.3 billion people on the continent through acquiring between 25 to 30% of the vaccines through the COVAX initiative, and the rest through the African Vaccine Acquisition Task Team that was established by the African Union to complement what COVAX would provide in order to achieve herd immunity across Africa. GLORIA MUTESI reporting for RTV News.